Hello, my name is Javier Neyra. I'm an internal medicine resident at Henry Ford Hospital, and I'm going to present you a little bit of the findings we got with this study. We basically wanted to analyze the impact of the dipstick proteinuria testing. That is a common test that is frequently done in septic patients admitted to the ICU. And it's usually done because they are working out the infection and try to look for the source of the infection. So it's a test that is most of the time done in this population. So we were interested in the occurrence of proteinuria in patients that had documented negative proteinuria before, and also that patients that have, by definition, not chronic kidney disease. That means the creatinine was less than 1.5 milligrams per deciliter. We included a total of 2,000 patients, but then we needed to exclude because of this very specific inclusion criteria. That means within the 3 months prior to the admission to the ICU, we needed these patients to have documented negative proteinuria, and also these patients to be had at least in a period of 0 to 72 hours from admission, at least one value of dipstick proteinuria tested in the hospital. So we ended with 400 patients, and from these 400 patients, we analyzed the impact of dipstick proteinuria in the prediction of acute kidney injury. We know that acute kidney injury is very common. Approximately 30% of the patients admitted with sepsis to the ICU develop acute kidney injury. And in our study, the occurrence of dipstick proteinuria found that it's an interesting predictor of acute kidney injury in this specific septic population. So when we try to adjust this dipstick proteinuria to other factors that could also impact acute kidney injury, such as heart failure, hemodynamic instability, meaning the use of pressors, or inotropes, the duration of the ICU stay, and different other variables that could affect the outcome, we ended finding that the dipstick proteinuria, the occurrence of dipstick proteinuria, it's an independent predictor of the appearance of the development of acute kidney injury in the ICU stay in patients admitted with severe sepsis. These findings are correlated with preliminary animal studies, where there is the theory that when you are in sepsis, you filtrate more protein, when also you have some impairment in reabsorption of protein and in terms of the tubules. And there is also the theory of a gene induction, where there is some protein secretion in the tubules. So the occurrence of proteinuria is expected in these patients. Now our challenge is to try to interpret these findings and try to see if this dipstick proteinuria could really represent an early biomarker of sepsis, acute kidney injury in the ICU.